I'm here today to talk with you a little bit about sciatic pain. Sciatic pain is something that's extremely common. In 2020, the University of Washington's Global Burden of Disease lists it as the #1 leader of years lived with a disability. That globally there's 619 million people that deal with low back pain. So it's a really common thing, and for many it's disabling. For about 30% of people, it will lead to a symptom called sciatica, which is the irritation of nerve roots that come out of the back and then go down into the leg. The sciatic nerve is the largest nerve in the body, and it's one that's typically affected by, in about 85 to 90% of people, a disc that's either herniated or bulged. So this is a really common thing. It's estimated in the United States of America alone that there's 247 million work days lost every year just due to low back pain, of which sciatic pain is a very common side effect. And it's not that it's just something people deal with, it's oftentimes something that they deal with chronically or long term, something that they don't just have for a short period of time, but it tends to be something that's burdensome for a very long period of time. Again, the #1 leader as far as the global burden of disease and years lived with a disability. So this isn't something that's like uncommon, it's something that's extremely common. And so part of what I'm going to discuss with you today is a potential option for people who have low back pain and sciatic pain, but yet are thinking, well, what are my options? Are my only options to take a drug or to have a surgery? What I'm here to share with you is that we actually recently have a study that we've done that's in process of publication. I'll actually be at a research symposium for this in a short period of time, but it's with a firefighter, a person whom, due to their job, due to the labor of life, is 47 years old, has had trouble getting his oxygen tank on and off, climbing ladders, helping assist with patients who are in need. And so the person's had sciatic pain and low back pain chronically. So 7-month duration of time where they're dealing with it day in, day out. What happened is they came into the office and I used the NUCCA procedure. So as a board certified NUCCA doctor, I'm using a series of procedures that analyze a problem with the head and the neck and use imaging to determine exactly how to correct that problem with the head and the neck that's affecting somebody's posture. That problem with the head and the neck will create a short leg, a low hip, and if you have a problem with a short leg and low hip, that can affect your discs in your back and hence create low back issues or sciatic pain. This gentleman came in, I made a correction to him after imaging him and then discovering how to go about correcting his problem. We then imaged it after to verify it was effectively corrected. And then what we did is we monitored the individual over the course of 18 weeks. In the process of correcting and then monitoring the individual, that individual actually ended up holding that correction. So for that 18-week duration of time, they maintained the correction, having level legs, balanced hips. They started off with an 18-pound weight differential that went down to 1.7 pounds. So there was a structural change in their body that happened as a secondary result of correcting the problem at the base of their skull, as a board-certified NUCCA practitioner does. After doing that, the patient then stabilized. They maintained that for 18 weeks. And not only did they maintain it, they had a 100% resolution of their long-term or chronic low back issues that they'd had for 7 months, and 100% resolution of the 7-month-long sciatic pain that they'd had. That's a pretty remarkable thing, because many people don't realize that you can actually have a problem up here with your neck that's causing an issue with your back. And they would say, well, how could a problem with my neck affect my back? The answer is you have centers at the base of the skull that control fibers that cause one side of the body to pull tighter than the other to create a short leg and to affect your posture. Hence, when we correct the problem up here, it changes people's posture, changed or corrected his leg length imbalance, his weight differential, and then allowed for a 100% recovery of his long-term or chronic sciatic and low back issues. So if you're out there and you've never heard of what I'm talking about, you don't know what a board-certified NUCCA doctor is, there's a lot of information that we have out there, but there's a solution for many people that they're unaware of in the correction of the head and the neck that has helped thousands and thousands of patients who've had low back issues and sciatic issues. And it doesn't just help a couple. It's consistently very effective when you correct this and change people's posture for allowing their issues with their back and sciatic issues to recover. So if you're looking for a solution and you're a low back or sciatic issue, if that's the problem that you're having, we don't treat sciatic pain or low back pain specifically, but we correct a problem at the base of the neck that changes people's posture and can allow for you to have a full recovery just like this gentleman did.